right now on 10 News at 11.
Some North County leaders are pushing to reopen by May 1st.
We want to get people back in their jobs.
Why they believe they can keep people safe while kickstarting the economy. Plus, a local woman facing a high-risk pregnancy now told her husband can't be there during the birth.
I'm terrified and I'm nervous and I'm scared.
The mother's fight to make sure she's not alone for that special moment.
Live from the Scripps Studios, this is 10 News.
Some North County cities are pushing state leaders to allow some non-essential businesses to reopen by the end of the week. Good evening, I'm Steve Atkinson. Our 10 News reporter Anthony Purro spoke with business leaders about the challenges many who are facing the eager and ready to open their doors. Businesses in the North County have been hit hard by the pandemic. Those that are still open are considered essential and following strict social distancing guidelines. San Diego County Supervisor Jim Desmond believes non-essential businesses like salons, restaurants, and large retail should be allowed to reopen under the same rules.
We figured out how to safely do it with the essential businesses. Let's give some of the non-essential businesses the same opportunity. I mean, you can run 1,000 people through a grocery store in a day. You'd think you'd be able to move 50 people through a car dealership.
Carlsbad's economy has been rocked hard by the stay-at-home rules. Their mayor and mayors from surrounding North County cities are standing with Desmond to push for the rollback of some of the restrictions by May 1st.
They got to be open in order for them to be prosperous. And so we're trying our very best to be proactive, to let business know that they're going to need to set protocols.
That will be important for businesses to know. Based on a recent survey conducted by the North San Diego Business Chamber, for many, reopening won't be like turning on a light switch.
A huge amount of them said, well, they want to open. They need at least a 2-week notice to prepare for that opening because they need to redo personnel handbooks. They need to do training of their staff. This is a whole new normal.
Anthony Purra, 10 News. So tomorrow morning, Supervisor Desmond, along with the mayors from Carlsbad, Escondido, Oceanside, San Marcos, and Vista, they will all hold a joint news conference about readying businesses to reopen by May 1st, which is, of course, the end of the week. Tomorrow, Governor Gavin Newsom is also expected to lay out plans to reopen California's economy. Today, some of our local beaches reopen, but there are rules people need to follow so that they stay open. Lots of people got in the water today, so you can kayak, you can paddle, you can surf, fish, run, walk, but you cannot lay on the sand. Otherwise, lifeguards and law enforcement will tell you to keep on moving. The new rules also recommend wearing face coverings. San Diego lifeguards tell us people were cooperating today, and the Sheriff's Department says one person was arrested in Encinitas related to the beach closure. And this afternoon, San Diego Mayor Kevin Faulkner said that he is pleased with what he's seen so far at the beaches as they reopen.
I am happy to report you stayed classy, San Diego. Very well done so far. When we've seen other beaches across the U.S. have reopened, you saw, unfortunately, pandemonium in some of those. Today, the nation saw San Diego acting like America's finest city.
But the mayor did stress this is just a start. Another big test will be this coming weekend. He says we have to keep it up if we want to get to phase 2, which is a more complete reopening that would include parking lots, piers, and parks. Beachgoers may see more federal agents on horseback patrolling the coastline. Border Patrol says it is concentrating on ocean border crossings to prevent COVID-19 from crossing the border. According to the Union Tribune, it is not clear how many horses are being used or where they will patrol. A Border Patrol spokesman says they could appear at any beach from the border all the way up to Oceanside. And we could see some of those beach crowds get smaller as we start to transition to some much cooler temperatures. Our meteorologist Angelica Campos joins us from home where she is tracking these numbers tonight. Angelica.
Hi, Steve. Good evening, everybody. It has definitely been much cooler today around the county, but looking at some of the numbers, mid-80s in parts of our inland communities, including Escondido, Valley Center, and Poway, and we do expect those numbers to rebound once again this week. So while today was slightly cooler, the temperatures will take a while before they are a lot cooler. The big cool down will be for the weekend. In Ocotillo Wells, temperatures did make it into the triple digits, and for tomorrow, we're going to keep it in the mid-70s at the coast around 82 degrees in our inland communities. And like I said, the heat continues for the deserts with an excessive heat warning in effect until Thursday night at 9 p.m. It'll be after Thursday when temperatures will begin to cool down. We'll have your 7-day forecast coming up.
Angelica, thank you. All right, here's a look at the latest coronavirus numbers in the county. 98 new cases reported today. That brings our total to 3,141. The county also announced 2 more deaths today. That brings our total to 113. But more than 1,700 people in San Diego have recovered from the virus.
We're supposed to be feeling joy and happy, and I'm terrified and I'm nervous and I'm scared.
A North County mother is just weeks away from giving birth to twins. She says she was told that she would have to deliver her babies alone without her husband in the room. Our 10 News reporter Laura Acevedo spoke to the family, who hopes that something changes before her delivery date.
It was last October that the Burkett family found out their family was growing by 2.
Never thought that we would be in this position that we're in right now.
Now just 4 weeks away from delivery, COVID-19 is changing their plans.
Yeah, pretty much every emotion in the book.
Kimberly and Sean Burkett found out she'd have to go through delivery alone without her husband in the room. He'll be allowed to join via Skype from outside the delivery room.
Labor and delivery is allowed 1 support person, but then next to it, it said no support person allowed in the OR.
With potential complications with one of the babies, Burkett is considered a high-risk pregnancy, which means she'll give birth in the operating room, not a standard delivery room.
It doesn't matter how I deliver, it has to be in the OR.
The family has Kaiser, and they've looked for other affiliated hospitals that will allow her husband in the OR. But because of the potential complications, they also need a hospital that has a NICU, just in case.
Important for me to be in there. I mean, just to support my wife in general. And then been a part of it for my first 2 children. And I'd like to be a part of it for my next 2.
The family lives in Vista, but are scheduled to deliver in Riverside on May 25th.
Our delivery date is getting close and things are not really changing, so I'm feeling very, very worried.
The Burketts say Kaiser told them things could change closer to the due date, and while they feel worried, they are still hopeful they'll be able to experience the birth of their twins together.
We're not going to give up.
Yeah.
You know, we're going to do our best so I can be there. I mean, it's very important for both of us.
Laura Acevedo, 10 News.
We did reach out to Kaiser to find out more about their labor and delivery guidelines during COVID-19, but we've not heard back yet. On its website, it does state only 1 birthing partner is allowed, but does not specify for deliveries in the operating room. A local father has won an uphill battle against the virus. Yara Ayala says that her husband Miguel was discharged from the hospital after spending nearly a month in the ICU on a ventilator. Miguel had heart surgery 3 years ago and is taking blood pressure medication, which made his fight against the virus very difficult. Well, now his wife says he is at home, he is resting, and thanks everyone for their prayers and their support. That is fantastic news. The Defense Secretary has still not decided whether to reinstate the captain of the San Diego-based USS Theodore Roosevelt. Brett Crozier was fired after his warning about the COVID-19 outbreak on his ship was leaked to the media. The Navy has recommended reinstating Crozier, but his status is still up in the air as of tonight. More than 800 sailors on that ship, including the captain, have tested positive, and 1 actually died. The Roosevelt is currently docked in Guam. 75 detainees in the ICE custody at the Otay Mesa Detention Center have tested positive for the virus. According to the agency's website, that's the most of any of its detention centers around the country. The next closest is in Batavia, New York, which has about 49 cases. On Saturday, the ACLU filed a lawsuit demanding a drastic reduction in the number of people in U.S. custody in Otay during this pandemic. Specifically, they want the release of the people 45 and older and those with underlying medical conditions. Meanwhile, we have learned that 2 of the homeless people moved into the San Diego Convention Center also tested positive. They were moved to a hotel. Mayor Faulkner says that testing happens daily, as so far 660 tests have been administered. And as the U.S. nears 1 million confirmed cases of COVID-19, some states are lifting restrictions as others keep their quarantines in place. As ABC's Romina Puga reports, all are hoping to keep the outbreak in check.
As governors outline their plans for reopening their states, in New York, the U.S. epicenter of the outbreak, the battle is far from over.
Number of new cases, still 1,000 new COVID cases every day. Puts it in perspective.
In Massachusetts, another hotspot, Governor Baker announcing nearly 2,900 people have died, a staggering 56% of them in nursing homes.
The numbers are tough to comprehend, but they illustrate the lethal grip COVID-19 can have on seniors.
For the doctors and nurses on the front lines, a profound toll for witnessing so much pain. The New York Times reporting that Dr. Lorna Breen, the medical director of the emergency department at New York Presbyterian Allen Hospital, died by suicide. Dr. Breen had contracted the virus herself, recovered, and gone back to work. In hard-hit Louisiana, though, a reason to cheer. For the first time in 36 days, no one in New Orleans died of COVID-19. Some southern states reopening their restaurants this week, owners welcoming back their employees.
I'm kind of excited because these are my family. I get emotional. But, you know, these guys need work. They need to make money.
But health officials warn Americans should still practice social distancing despite leaving their homes. Over the weekend in Florida and California, crowds flocked to the reopened beaches.
This virus doesn't go home because it's a beautiful sunny day around our coasts.
And urgent calls from states pressing for reliable antibody testing in order to track the virus and help the country open up again.
The testing that's been developed and being developed right now has been truly an amazing thing.
But a new study of 14 coronavirus antibody tests found only 3 delivered consistently reliable results. Another reason reliable testing is urgent, the antibodies from those who've recovered from the virus could help treat those critically ill COVID-19 patients through plasma donations. In Los Angeles, Romina Puga, ABC News.
More